to my channel, Nurse Netta. For those of you who don't know me, my name is Lynetta Walker. I'm an LVN and I work in a hospital in Southern California, and I work in the emergency department. So in this video today, I'm going to be discussing with you guys my usual work routine and what I do as an LVN in the ER. So I work night shifts and I work 12-hour shifts in the hospital. So I work from 7 p.m. to 7:30 a.m. So I only live about 5 minutes away from my job. So I usually start getting ready for work and I take my shower and get dressed around 6 o'clock. I usually head to work around 6:45 or maybe 6:30, depending on if I want to go grab some coffee or something like that before work. But typically I leave the house around 6:45. So when I clock in, I usually go directly to the break room. That is where we have our huddle and we get our assignments, figure out who our charge nurses is going to be for the night, and just get updated on what's going on in the department for the week. Now, after we finish doing our huddle and we get our assignments, we head to the floor in whatever area of the hospital we're going to be working. In my hospital, we have 4 sections, I would say, of the ER. So we have what's called pods, which is like, I think there's like 15 to 18 rooms in one big nursing station in the middle. So we have 3 pods, and then we have a fast track area. The fast track area is meant for lower acuity patients with less severe conditions, and the LVNs run the fast track area. It's usually 1 to 2 LVNs with 1 provider. When I say provider, I mean either a nurse practitioner, a physician assistant, or a physician. So my typical routine, I'll go straight to the fast track area, and I'm usually working the fast track area from 7 p.m. till 1 a.m. That's when that area closes down. So I'll go to the fast track area. I'll get report from the morning LVN. She lets me know what's going on in the department, how many patients we have, who's being discharged, who needs to be medicated, things like that. So I usually get straight to work. Usually in the ER, it's like nonstop and it's very busy. So I get report, look at our dashboard, see who's in what room and who needs what, and I immediately get to it and I start grabbing medications, medicating, discharging, all of that. So I usually work the fast track area with a tech or a PCT. It's like a CNA, but they don't call them CNAs in the hospital. They call them patient care techs. So it's me, a PCT, and a provider in the fast track area, and we have 3 to 5 rooms in that area. So I can have up to 5 patients at a time. So during that time, like I said, I'm giving medications, I'm giving people their discharge instructions with their prescriptions, doing patient teachings. Depending on what these patients are being seen for, I have a wide variety and range of duties that I have to do. If someone comes in with a fractured ankle or something, I might have to do a soft cast or what we call a splint. I might have to do education for crutches if they need crutches. If you get a sprained ankle, I might just give you an ace bandage and wrap your ankle up. If you've had a dog bite or a laceration, got cut by something, we set up the laceration repair trays, whatever. So I'll set that up for the doctor. I'll give the tetanus shot if they're not up to date with their tetanus vaccine. Usually apply like either some triple antibiotic ointment or give them their first dose of antibiotics just to prevent any infection. If patients are there for nausea and vomiting, I'll give them their medication and do what we call a PO challenge. So pretty much we give the Zofran, which is an anti-nausea medication. We wait about 15-20 minutes and then we give them something to drink to see if they're tolerating the fluids well and that they can keep stuff down. So we do a lot. That's just a little few examples of what I do in the fast track area. So I'm usually working from about 7:30. I'll take my first 15-minute break around 10 or 10:30, depending on how busy it is. And then we usually close down fast track at 1 a.m. And when we close fast track, my responsibility along with the PCT is just to clean the room, sanitize everything, take the linen out so the linen barrel is not full, turn off the lights, close the door, and we shut down that area. After 1 a.m., we usually head to pod 2, and we start seeing patients in that pod. So usually I check in with the charge nurse, and she lets me know what rooms are available or what rooms are open. Now, sometimes if all of the rooms are full and all the RNs are, have the rooms occupied with patients, then we use the wall. So they have chairs and gurneys set up on the wall. So if you're being seen for something that doesn't necessarily need privacy, like you don't need a pelvic exam, a breast exam, or anything like that, maybe you're just coming for medication refill, or we need to remove a splinter or something minor, then we put patients on the walls and we see them on the wall, medicate them, and then discharge them home. So we usually do that. I usually take my lunch break anywhere from 2 o'clock up until, I think the latest we can clock out for lunch is like 3:30. So I usually do that, and we're usually pretty busy the whole time. So I'm in pod 2 from 1:30ish, maybe 2 o'clock, depending on how many patients we had in fast track, up until 7 o'clock in the morning. If I still have patients around 7 o'clock in the morning, nurses are coming in, I usually give report to the RNs about, who I have in the rooms, what's going on, and what their status is. If I don't have any patients, I usually stick around to about 7:15, 7:20, and then after that I head to the break room, and get ready to go home. So we do a lot in the ER. LVNs are responsible for a lot. We start IVs. We give IV hydration, like lactated ringers and normal saline if a patient is dehydrated. We cannot, as LVNs, give medication through the IV. That is out of our scope of practice, so we don't do that. But we can start the IV. We could DC the IV before the patient goes home. We just take the IV out. I do splints, give crutches, give injections. I give a lot of injections in the ER. I give a lot of pain medication, anxiety medication, a lot of antibiotic injections. What else do I do? I do a lot. Another responsibility as a LVN, we have a suture cart. So it's for like laceration repairs, and we have to stock it, make sure it's fully stocked. So we have our lac trays, triple antibiotic ointment, our gauze, normal saline, things we need to take care of any lacerations or dog bites that we have. So in between patients, so we're constantly calling patients from the waiting room into the room, and then before we discharge them, we send them to registration to just take care of the last bit of insurance information that they need for billing purposes. So in between patient care, I sanitize the room. So I wipe down everything. If they're in a room where there's no gurney and it's just, a chair that they're being seen in, I make sure I wipe down and sanitize the chairs, the call light remote, the TV remote, because sometimes they use that. Wipe down the tables. I'm a little bit anal about germs, and I'm a low-key germaphobe, so I take like the wipes and I sanitize the door, like the door handles, and the light switches and all that. I'm so extra. And if they've been placed in a room where there's a gurney, I strip the bed. So I take off all the linen. I wipe down the mattress, wait about 2 minutes for it to dry, and then I put clean sheets on the bed. So that's what we do, and that's in between every single patient, no matter what. So yeah, I do that. So the LVNs work directly with our providers. So we're like this with the doctors the physician assistants, the nurse practitioners. We're like their right hand man or woman. So we are very close, and everything is like a collaborative effort. You don't feel like you're alone. You don't feel like you're lost. If you have questions, someone is always there to answer the questions for you, so that's never a problem. So a cool thing that the department incorporated recently is what's called, they call it a Zen den or a Zen room. It's a meditation room. So they took one of the charge nurse offices and they completely transformed it into a meditation room. So if you're on your 15-minute break, or if you just been involved with something very traumatic happening in the ER, like a cold, and maybe your patient passed away, you can go and debrief and just kind of regroup in that meditation room. And they have like a Himalayan salt lamp. They have essential oils burning, so you get the aromatherapy. It's really relaxing, and you could just kind of relax for a little bit, or after your shift is over, before you go home, you just want to kind of relax and calm down. You can go in our meditation room, and I think that's pretty cool. So I usually clock out at, the earliest we can clock out is 7:23, and I believe the latest is 7:37. So I usually always clock out around 7:25 or 7:30, and I usually just go straight home, take a shower, eat something, and go to bed. And when I sleep, I usually sleep for a couple hours. I sometimes have a hard time falling asleep directly when I get home from work. So I'll get home from work about 7:45, take my shower, maybe have a light breakfast, and I'll sleep sometimes from 9 to maybe 1:30 or 2 o'clock. I don't sleep long, unless I'm just dead tired and I had a shift that just completely kicked my ass. Then I sleep for about 8 hours straight. But usually I sleep for about 4 to 6 hours. So that is my work routine as an LVN working in the hospital. I love working in the ER. I feel like it's a match made in heaven, and it's a perfect fit for me, and I absolutely love it. So let me know in the comments what you think about this video. If you are a fellow LVN and you also work in the ER, or if you're interested in working in the hospital in the ER, comment down below. Let me know what you think about this video. Comment, like, share, and please subscribe, guys. I love all you guys, and I appreciate you guys. Until next time, bye.